Imagine your blood factory completely shutting down the very system that creates life. Giving cells stops working. For many patients with blood cancers or bone marrow failure, this is a terrifying reality. But today, medical science offers a miracle: bone marrow transplant surgery, a treatment that has given thousands of people a second chance at life. In this video, we'll break down what exactly a bone marrow transplant is, why it's done, step-by-step process, risks and complications, survival rates, and what recovery looks like. Stay with us till the end. This might be the life-saving knowledge you or someone you love truly needs. What is bone marrow and why it matters? Bone marrow is the soft, spongy tissue inside our bones that produces red blood cells, white blood cells, and platelets. Red cells carry oxygen, white cells fight infection, platelets help in clotting. When diseases like leukemia, lymphoma, multiple myeloma, or severe aplastic anemia attack the marrow, it can no longer do its job. The result: life-threatening infections, uncontrolled bleeding, and oxygen starvation. This is where bone marrow transplant, BMT, also called stem cell transplant, comes in as a life-saving treatment. Types of bone marrow transplant: there are two major types. One, autologous transplant. The patient's own stem cells are collected, treated, and given back after high-dose chemotherapy. Often used in multiple myeloma and some lymphomas. Two, allogeneic transplant. Stem cells come from a donor, usually a sibling or unrelated but genetically matched person. Used in leukemia, aplastic anemia, and other inherited disorders. The choice depends on the disease, patient's health, and donor availability. Step-by-step transplant journey. 1. Pre-transplant evaluation. Doctors run tests to check heart, lungs, liver, and kidneys. Psychological readiness and family support are assessed. A donor match is searched if allogeneic transplant is needed. 2. Conditioning. Chemotherapy/radiation. High-dose chemotherapy or radiation is given to destroy diseased bone marrow. This clears space for new healthy stem cells. Side effects: nausea, hair loss, fatigue, mouth sores. 3. Stem cell infusion. The transplant day, healthy stem cells are infused through enrollment. 4. Like a blood transfusion, it's painless and usually takes a few hours. Patients often call it their second birthday, the day their new life begins. 4. Engraftment phase, waiting for cells to work. New stem cells travel to the bone marrow and start producing blood cells. This usually takes 2 to 4 weeks. During this period, patients are very vulnerable to infection. Protective isolation, antibiotics, and blood transfusions may be needed. 5. Post-transplant care. Continuous monitoring of blood counts, medications to prevent rejection and graft versus host disease (GVHD), emotional support, and nutrition therapy. Risks and complications. Bone marrow transplant is powerful but not without risks. Infections because immunity is wiped out during conditioning. Bleeding due to low platelet counts. Organ damage: liver, lungs, or heart may be affected. Graft failure: new cells don't start working. Graft versus host disease (GVHD), donors' immune cells attack patient's body. Symptoms: skin rash, diarrhea. Liver issues can be mild to severe, sometimes life-threatening. Doctors balance risks with preventive measures and close monitoring. Success and survival rates. The success of a bone marrow transplant depends on the disease being treated, age and health of the patient, donor match quality. On average, autologous transplants 70–90% success in multiple myeloma and lymphoma. Allogeneic transplants 50–80% success, depending on donor match and disease stage. Many patients go on to live long, healthy lives after transplant. It's not a guaranteed cure, but for many, it's the only chance of survival. Recovery in life after transplant. Recovery is a marathon, not a sprint. Hospital stay 3–6 weeks, full immune system recovery 6 months to 1 year. Precautions: avoid crowds and infections. Eat a clean, balanced diet, take medications regularly, attend follow-up appointments. Emotional healing is equally important. Support groups and counseling play a big role in long-term recovery. Frequently asked questions. Q1. Is a bone marrow transplant painful? No, the transplant itself feels like a regular Roman IV infusion. Pain may come from chemotherapy side effects or donor cell harvesting, but it's manageable. Q2. Who can be a donor? Usually siblings have a 25% chance of being a perfect match. If not, unrelated donors or even umbilical cord blood can be used. Q3. What is life expectancy after a bone marrow transplant? If the transplant is successful, patients can live decades. Many survivors lead completely normal lives. Q4. Is it worth the risk for life-threatening diseases like leukemia? Yes. For many patients, it's the only hope of long-term survival. A bone marrow transplant is not just a medical procedure, it's the rebirth of hope. It's about courage, science, and the gift of life from one human to another. If you or a loved one is facing this journey, remember, while the road is tough, survival and recovery are possible, and thousands of families have seen this miracle. Stay strong, stay informed, and always consult your healthcare team for personalized advice.